the aim of this session today is aimed to be really interactive. The main important thing today is about building confidence in people working with children and young people and families as well. So it's about building confidence in testing, communication, making testing calm and not feeling like a test. So hopefully you get positive and successful outcomes. If you do have any questions at any time, please do pop them in the chat. And in the meantime, if you want to just introduce yourselves in the chat, so just your name, where you're working, and also your profession, whether you're a nurse, HCA, nursing associate, it would be really nice to know. With regards to this, it came about because I have developed a children and young people's asthma pathway for Somerset, and I am super excited to be a part of that, because something I've always been passionate about is making sure that children also get the same access to tests that adults do. And that's been one of the problems in the past. The community investigation hubs have, in some circumstances, only looked at doing tests in adults. So that's not the case for us in Somerset now. Obviously, you're all working with children and families as well. So in terms of what we're going to cover today, it's a flexible agenda, and I'd love to hear from you in the chat throughout, and if you'd like to unmute to ask anything, you're very welcome to. We will be looking a little bit at the asthma pathway and your role, and the pathway itself. We've got some 3-hour training sessions, but the pathway is really developed for those that are making clinical decisions. So whether you're diagnosing, managing chronic or acute asthma, doing annual reviews and that sort of thing. So some of you might be doing that as well. But we know that sometimes in the community investigation hub, it's purely potentially performing the tests. So that pathway might not be relevant to you. So that's what or at least not all of it. So we don't want to, cover all of that today if it's not relevant to your role, but you would be more than welcome to access that training. We're going to be looking at communication that works. Okay, so making sure that we are, communicating effectively at the right pitch for our children and young people, with a big aim of reducing anxiety, making sure that we gamify tests. That's the key thing, isn't it? Not making it feel like a test. And we will put this into practice with some sort of scenarios and some top tips as well. And if you've got any positive experiences or scenarios, then, please do feel free to share those. So I did really want to say that your role matters. So I mentioned that the pathway might not be fully relevant to everybody who's working in the community investigation hub, but that doesn't mean your role doesn't matter. Even if you are purely performing the tests and they go back to the practice, your role, you play a key role in allowing children to access appropriate tests. And that's huge, because that hasn't always been the case. You have, your role helps children to feel safe and calm in that environment. You're helping to support good quality, successful testing that then will go back to the person that's requested that test, who that child may not have been able to access that within a practice setting, but you within a community investigation hub are able to provide that service. And you shape that child's experience, and we're going to hopefully today show how that can be a positive experience and hopefully less clinical as well. So you are very much supporting diagnostic accuracy, potentially without diagnosing, although I know some of you on the call today very much are involved in the pathway and the whole process. So, that's great as well. So this is what the pathway looks like. I will load it live sort of towards the end of the session. This is like the landing page. So you can see here it's a lot, but each of these boxes is designed to cover a topic. So the top 3 boxes are very much around why the pathway is here, the clinical governance around that, why we're doing it. So reducing health inequality, so thinking about age differences, deprivation, Black and ethnic minorities, for example. And the 3rd box, that might be relevant to some of you, just to explore actually what level am I working at, and therefore what training do I need? So that's the training and competency framework within that box. Then the rest of it is broken down into history taking and making a diagnosis, whether that's under 5, so you can see it's broken into age groups, 5 to 16 years old and over 16. And then you've got the management for 5 to 11, 12 to 17. Okay, we've got a little bit about transition to adult services. We've got an acute management section, which we're doing a little bit of a revision on that one at the moment. And we've then got the annual review and optimal management, when to refer, and something that will be particularly useful to you. Even if you purely perform the test, you might not be responsible for clinical decision making and utilising the rest of the pathway. But the CYP, by the way, that's children and young people, Asthma Care Resources, a really nice one-stop shop page. So for example, if you were seeing a child, a family, to do a test, and they wanted some more information about something to do with asthma, for example, you could signpost. You could load this up on your computer. You can have it sort of, on TeamNet saved as a favorite, and you can say, well, actually, I could text you some information about that if you like. And you can also access information about the tests, because we've got a lot of things on there for Asthma and Lung UK. So you probably will particularly utilise that resources box. And if you are involved in diagnosing and managing, then this whole pathway is relevant to you. Okay, so environment matters. If possible, we want to be trying to make this as child friendly as possible and less clinical. So the difficult thing is a lot of us are working in rooms that aren't necessarily designed for children. I think if you're in a specifically designed community investigation hub, so for me in Bridgewater, Victoria Park, actually called a health and wellbeing centre, it's so much less clinical. It feels so much more comfortable and inviting. So that does make a real difference, but you can still tweak your clinical rooms if that's the environment that you're in. We really want, when that child walks in, we want them sort of ideally not to feel like a clinical space. Okay, we want to think about what the child sees at their eye level as well. Okay, so even if it's just adapting and having a few pictures on the wall, something bright, something colourful, something for them to play with that's perhaps white clean to meet our, infection control procedures and things like that. Obviously, the Aero Bear, which is on your screen there, which we can actually access free of charge from Trudell Medical, that's obviously not wipe clean, but for me and anyone else that's sort of a nurse, or you may get a parent ask this question to any of you, it's actually quite nice. You can actually show them with this, if it's a particularly young child, the spacer with the mask over the teddy bear just feels a little bit less threatening, really, a little bit less obtrusive and invasive. So it's just thinking of how we can make that for that warm and friendly approach. So yeah, pictures, images on the wall, that can really help. Anything that's wipe clean. Try not to have things like needles and sharps and things like that. Obviously, you're not going to have them in reach of children, that goes without saying, but even in view of the child, some of the things even that we might not deem as scary can be really quite scary for children. So it's trying to see your room through the eyes of a child if you can. But yeah, bring things in gradually, just make subtle tweaks. It doesn't have to be major. I appreciate we are limited with infection control and things like that, but a bit of colour. Catherine, do you want to unmute?
I was thinking maybe some colourful children-like tabards could go over uniforms. Thought that would be quite nice with like teddies and whatever on, just so you're not looking as clinical.
Yeah. And I mean, I know some people wear sort of scrubs, some people wear a full uniform. You can get the really nice hello, my name is badges. That's really nice. Some of them have got like a smiley face on them as well. And I think that's always how you want to open an appointment, is making sure you are down at the child's level. And yeah, don't be afraid to speak to the child. That's what today's all about, is building the confidence to talk to the child. But yeah, anything that you think would appeal. And if you've got your children, nieces, nephews, grandchildren, that sort of thing, you can ask them about it as well. But I think if you could pick a few quick wins, it would be add something visual to the walls, keep equipment that's very medical out of sight if you can. We want to try and keep, as clear as possible anyway, really. Sit at the child's level, remove obvious clinical clutter, and have a simple distraction toy if available. And depending on the age of the child, but utilize your screen, like especially if you're doing like FeNO or spirometry, we're going to go through some of the lovely imagery and incentives that you can use. Can't get away from digital technology these days, can we? And actually sometimes you can use it to your advantage. So how may children feel? And this is, I always try to put myself in their position essentially. And, some children, the only time they've maybe been to the surgery is for their vaccinations. And they might see that as a negative thing. And sometimes parents, family, carer can contribute to that anxiety, because they also don't necessarily particularly like going to a medical environment. So that child might feel nervous or scared, unsure what's going to happen during this appointment. They might be embarrassed or shy. I know my youngest, she's now 11, just turned 11. But, you know, I remember if we've ever been in, sort of she's ever so quiet. It's like a different child, like a different person. So again, it's always putting yourself in their position. And they might be tired or unwell. They might not have slept well last night. They might also be ill, and that's why they're presenting, for example. So it's just trying to acknowledge that their feelings, which often explains their behaviour, doesn't it? And we're going to talk about some different scenarios as we go through the session today. So communication that works then. Most of you have already got the technical skills for the job. Today actually isn't about how you do FeNO, how you do spirometry, although of course if you do have any questions on those things, I am more than happy to answer them. And today is not designed to be just, this is all you get, off you go. We are, you know, the GPSU, the General Practice Support Unit, are very keen to support you in your ongoing training, professional development. And that's something we'd like to collect in feedback as well. Is if you feel there's particular things that you could do with some support with, or some training, I know Catherine on the call today can help with some of this as well, then please do let us know, because that's the aim of this really. It's really important that we do clear explanations, and I've got some things that I would probably avoid saying and some things that we would rather say. So less clinical language, simple terminology. Speak to the child directly, get down at their level, be friendly, be approachable. And those instructions do need to be kept simple, one at a time. Don't bombard them, which is why sometimes you do need a bit of a longer appointment. And also show and then do. Okay, so I sort of tell them, show them, and then get them to have a go if possible. So yeah, you can have the best equipment in the world, but if the child isn't engaged, that test is not going to be successful. So yeah, simple always wins, I would say. And then, you know, some people want more information than others, obviously, and it does depend on their age. So we factor that in too. So good versus not so good. Rushed, speaking really quickly, which I know I'm guilty of generally in my teaching. I'm always trying to cram lots in. So I always try to slow down if I can. And it's good to recognize your strengths and weaknesses. But lots of instructions is just overwhelming for them and confusing. And there might be some words like FeNO, spirometry, that you use all the time. That's a foreign language to them and their family often. So yeah, don't talk just to the parent. That's a definite not so good. And no praise, making it feel like a test. We've got to get this done today. I've only got 5 minutes left. That's really not going to help things. In fact, in the circumstances where things really aren't going well, sometimes you need to take a breath. Do we think we can actually achieve this with how things are going today? Perhaps we need to rethink, reset, and bring them back on another day. But yeah, the good is calm, simple, and encouraging, engaging with the child. And actually, sometimes it's more about, it's not so much about getting the absolute perfect test. It's about making the child feel comfortable to do the best that they can. And it might, like I said, it might not always be a perfect test, but you're doing the best that you can. So these probably look familiar to you. Do you all do some of these tests within your environment? Yep. So FeNO, fractional exhaled nitric oxide. Even saying it in its full term is not going to be any better for the child or the family. So explaining, you know, I quite often use analogies like, you know, if you're exploring whether this could be asthma, that asthma is a little bit like eczema on the inside. So this particular test that we're talking about, so I'm talking about FeNO at the moment, is, you know, it looks at this swelling. We call it inflammation. It looks at the swelling in your airway. So if you've seen eczema before, you can get some sort of red, itchy, swollen, you know, wherever the area is. And that's a little bit like what can be going on inside your lungs because of certain triggers in the environment, like it might be cats or dogs or aerosols. And, you know, they might have already told you about some of those things anyway. So FeNO and fractional exhaled nitric oxide, you're going to say what, you know, you will say the name of the test, but it's explaining what it measures, and that's inflammation in the lungs. Spirometry is a breath test. This looks at how your lungs, your airway performs. It's a blowing test. Peak flow is also a blowing test. That's a bit of a shorter one. And you might be doing blood tests as well. I believe at the moment, paediatric bloods might not be part of the community investigation hubs. This is something we've actually discussed on the 3-hour full pathway training, because it is part of the children and young people diagnostic pathway for asthma. It's right at the end because it's quite an invasive test. But actually, it seems a shame to have to refer a patient into a secondary care hospital environment to have that done. But there seems to be a bit of a lack of training. So it's maybe something that we can look at sort of in the future. And I know people think, oh my goodness, blood tests in children. But actually, you'd be surprised at how some children manage this. And again, it's all to do with how calming you are, how well it's explained, how on board mum and dad are, etc., etc. But I know my children would far rather go to Victoria Park, where it doesn't feel like a hospital or a clinical environment. If they had to have a blood test, I think that would be one of the nicest places to have it. So that's interesting food for thought in the future. Also, if you do want some more information on these things and how you can explain it to mum, dad, caregiver, even the child, Asthma and Lung UK have a page on asthma and my child. And I've popped the box there, testing for your child's asthma. It gives you some terminology that you can explain. And if you are short of time, you can also send them the text message, the link to this actual section of that website. So today is a lot about signposting as well, recognizing what you can actually fit into an appointment. But if you know somebody's coming for a test, and we're going to talk about the scenario of an anxious parent as well as an anxious child, you could send this information out before they come to you, couldn't you? Or even we could encourage the practices that are referring to you for these tests to send out this information in advance, because it's reassuring and you're not so anxious then because it's not the unknown. Don't forget, if you've got any questions at any time or comments, do pop them in the chat. So make it fun. That's such an important thing. If you had an aero bear, you can, like I said, you can hold the spacer over it. You could pop the peak flow meter up to its mouth. You're just making them feel sort of more comfortable, really. But with regards to making it fun, with spirometry, we're going to give some tips for this in a minute. We use phrases like, because obviously they have to blow as hard and fast as they possibly can for as long as they can. It's about using analogies to help them. So everybody's blown out birthday candles. We say we've got loads of birthday candles, but maybe they're quite far away from you, and I need you to reach all the way over there, so that may take a bit longer. So you want to blow as hard and fast as you can, try and get as many candles out as you can. So they find that fun and exciting. I did have a little boy once, though. I think he's about 5 or 6 years old. He was quite young, and again, you never lose that thing of, will they be able to do it? Is it going to be a difficult consultation? And I was trying to get him to do spirometry. And I did hold the whole blow out the birthday candles thing. Do you know what he said to me? Not my birthday. He literally said, it's not my birthday. So, okay, fair enough. How am I going to get through this? So literally changed it. And I talked to him about blowing like a dragon, blowing fire like a dragon. Well, he was all in at that point. So again, not every child is the same. And you might have children with various learning needs and things like that, and that can make things a little bit more complex. Other factors can definitely play a part. So it's about getting them to be all in if you can. Adapt your language, make it fun. You can talk about blowing up a balloon. That first bit is really hard, so you've got to do that real blast. That's more spirometry. When you're doing FeNO, as you probably all know, children still have to blow out for 10 seconds, roughly. It's about 12 for an adult. So they do need a really deep breath in. So always talk about puff your chest out, show me your muscles. And it's not about blasting really hard and fast, but maybe they've done that before. And that's what they're going to potentially do again with FeNO. So with FeNO, I talk about keeping the candle flickering. We're not trying to blow it out anymore. We're trying to make it move, but we're trying not to blow it out, because as you know, it's like a breathalyzer test. It's a more controlled blow. And quite often with FeNO, and this is adults as well, they start off and they blow really hard or too hard, and the car goes beep, 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 beep off the road, or the fish off the bubbles. So then they kind of stop, or the flow goes beep, 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 and it's all the way down here, and they bounce through the test. Okay, it's okay to take more than 1 or 2 attempts. That's okay. But actually, if you explain it more like building up to getting the car on the road or the fish on the bubbles, and keep that candle flickering, you're more likely to get a good test straight away. So it's these types of explanations and information giving, but also, doesn't this gamify it? Children want to have another go. I'm thinking, oh gosh, I actually am running out of time here, but okay. They want to have another go. They want to do better on spirometry, or they just want to have that game on the FeNO again. So it's really nice that the companies have acknowledged that this really helps to get them through the test. So a little bit about what to say and perhaps what not to say. Take a maximal inspiration. I might be okay with an adult, mightn't it? But actually maximal inspiration, most children are going to be looking very confused at this point, and they'll often go within themselves, and you notice that they're just not engaged in that in that appointment. So big breath in, big as you can. I want to see that chest come out really full up. Exhale forcefully until you are completely empty. That's quite relatively simple terminology, but actually making it more relevant to the child. Blow the birthday candles out as hard and fast as you can until you're completely all puffed out. Something like that will be more exciting for them. Exhale at medium force, so that's with your FeNO. Blow out steady so the candle flickers. Okay, or like you're trying to blow continuous bubbles underwater, like you're a snorkeler. They quite often start telling you about their interests when you start telling them about some of these things, like I do swimming club, or I do, and that's really nice. You want to have that conversation with them. You're trying to really build up that friendly professional rapport. If you guys have any words or spiel that you use, please do pop them in the chat, because it's always interesting to hear. Sometimes people come up with even better ones. So FeNO, do you guys, what FeNO machine do you have? Do you have like a Niox device, or do you have the Bedfont No Breath is probably the most common one? I think, did I have a picture back somewhere? Yeah, there, that's the Bedfont, that one on the left just there. So pop in the chat what FeNO machine have you got. But either way, they do both have nice visual imagery. So the Niox, that one's a little bit more expensive in terms of consumables and sort of maintenance, but it's still a very commonly used device. So yeah, most of you got sort of Bedfont. But they make it so it's designed to feel like blowing bubbles through a straw. It uses animated visuals. Not only do you get the pictures, and you can see some sort of examples at the bottom, but you also get the beeping when you're in the green zone, or if you're out of the green zone, if you're in the red zone and you're blowing too hard or not hard enough. That's really useful feedback to adults and children. Some of them have like a flow bar or a target zone, but it's really good at giving feedback both visually and audibly as well. So yeah, teaching tip for FeNO, it's like blowing bubbles steadily or slowly, not too fast, not too slow, or the candle flickering. We're not trying to blow it out. Okay, and then we often have a little joke about how, if I've lit a candle or something at the table or something like that, my children just cannot resist blowing it out. They just, can I blow the candle out? Or still, when I'm looking the other way, they'll blow it out. So yeah, this works really well for younger children. Frame it as a game with a goal. All right, because they're used to playing sort of video games and things like that. So it's like keeping the car on the road or keep the fish swimming smoothly. So it feels fun. It doesn't feel like a test that we must get through. So Rachel says, I tell them the fish get seasick if he bobs up and down too much. That's brilliant. I love that one. I've not heard it, but I think it's great. So with permission, I would like to use that. And then your Bedfont No Breath, which you might be more familiar with, that again is on-screen incentives to help maintain the correct flow. But I really like the analogy of the fish will get seasick and you want to try and keep him nice and steady and smooth once you get on the right bubbles. So yeah, this is designed to improve child compliance and also their technique. So you've got fish swimming, car on the road, visual target to keep in the zone. And the good thing about FeNO, which is different to spirometry, if the test isn't what's needed, you get a big X, don't you? So it's not just going to give you a false reading, it will give you an X. If it's a good test, you will get a green tick. So that's really nice. It's very obvious whether you need to repeat it or not. Getting the test, your feedback to the child, your explanation, and I demonstrate. I use the same. I keep my mouthpiece, in its wrapper, because I don't want to waste a mouthpiece every time. We're not using it to get a result for me. We're just using it to demonstrate. I do always demonstrate, and I do think that extra time in explaining and showing makes all the difference. But with FeNO, that is important, because the more attempts they do, as you can appreciate, they're blowing off their nitric oxide, aren't they? So if you keep doing it, you're going to get a falsely low FeNO reading. And I'm sure you will know, if you are doing FeNO and spirometry in an appointment, you must do the FeNO first, because you're blowing off the nitric oxide. But if you're doing the spirometry first, and then you'll get a falsely low reading. Okay, so spirometry tips then, different to FeNO. With spirometry, it is a very effort dependent test. FeNO's that control, it's getting control and smoothness. Spirometry with children, so we're talking under 16, 16 and over in the spirometry world is considered an adult. They just do the forced blows, the blasts, if you like, for as long as they possibly can. But yeah, their effort, you know, that's what gets a good test. So you need a high level of support and encouragement. But we're not telling them off, we're not frightening them, but you know, I have to be careful not to make them laugh when they're doing it. But you know, I'm saying keep going, you're doing super well, keep going, all of those sorts of things. And you can use the words around the incentives, whether it's popping the bubble gum, keep going, that bubble gum's nearly popped, and they can see it on the screen, it's getting bigger and bigger and bigger. And I don't know if you know, but the incentives are so well designed, if they burst the bubble or blow the candles out on the first attempt, do you know that it makes it slightly difficult next time? Because the goal is to push them on to do their absolute best. So that's really, really useful from the incentive perspective. But the key thing to emphasize is FeNO is slow and steady, game-like control. Spirometry, big, fast blow, big effort, lots of coaching and encouragement. Okay, but yeah, do use the incentives. They're within the software, within the spirometry, and obviously the FeNO machines. Make sure the child can see the screen, and you could even get their input. Which incentive would you like as well? That might tap into what they're interested in. So for the children that do come in and are anxious, you know, that's a lot of children, although sometimes we get the really chatty, happy ones that can't wait to come in and see you, and that's great, get a high five sometimes. It's important to normalise their feelings. So if they come in and they look a bit tearful, or they look a bit anxious, or they're struggling with the test, it's okay to say that this is completely normal. You're not the only one to find this tricky. There's a bit of a knack to it. Lots of children find this tricky. You're doing really, really well. Don't make it feel like a test that they must get done, and that they're doing really badly. Praise every effort, and then explain the bits that don't explain it, that it went wrong, but just say, do you think next time we could try this? And then I'll demonstrate again. Stay calm. It's easier said than done sometimes, I know, especially when, you know, I had a mum come in on her own. She had 5 children, different ages, running around, jumping on my scales, trying to nick my stethoscope. I had to give them all a job, you know. And actually one time I had a similar thing, less children, but chaotic. And I did actually have, mum was nearly in tears. And I reassured her and everything, and just said, it's okay. I said, you know, today is obviously a difficult day. So I really didn't want to miss the appointment. You know, I said, we can continue to try if you'd like to, but I can see that it's upsetting with you. Would you rather come back on another day when maybe you can get some help with some of the children? So that is not a failure. Okay, it's not, you don't want to make mum feel bad, you know. So every scenario is different. You've got to take it as it comes. Okay, but again, when you're trying to reduce anxiety, normalize their feelings, make sure you have introduced yourself, you know, and find out a little bit about them. Don't make them feel like they're being tested. It's much the same as the previous slide really, but offer simple choices. You know, would you like to try that again, or do you want to wait a little bit? You know, it's giving them choice. It's not right, we need to go again. It's, we can take a bit longer if you need to, or would you like me to explain it again? We can go through that if you like. Do you want mum to have a go or dad to have a go? You know, I've done that in the past as well. So all of those sorts of things can really help. But yeah, you're not just managing the child, you are managing the room, you're managing, you know, a number of different factors. Having a calming room can help, something to distract them. Okay, so we're going to look through some scenarios. They're very brief scenarios, but I sort of try and create a bit of background for you. But just to get you thinking, we're going to look at a 6-year-old who's completely refusing to do the test. We're going to use like an adolescent, like teenager, who's completely disengaged. I've definitely had that before. And also an anxious parent or parents or caregivers, and just thinking about what you would do. So 6-year-old who's refusing, maybe they've come in to do, I don't know, FeNO or spirometry. I've definitely had a child do that before, more than one. Wouldn't even go near the mouthpiece. Mum saying, mum getting more and more worked up, saying, just do it, we need to get this done, you know, we've got stuff to do after this appointment, the nurse hasn't got all day. I was thinking, you know, so it can be really difficult. But mum, dad, caregiver, trying to help, obviously, but actually you can see the child getting more and more worked up and just completely shutting down. So, you know, the well, I won't give you what I did. I'll get you to think about what you can do. So if you had a child in your appointment, and I don't know, it could be FeNO, spirometry, anything at all, and they're refusing, what would you do? How would you approach it? It's not an easy scenario, is it? We can't force anyone to do anything, and that wouldn't be the right thing to do either. But how would you approach that? Yeah, absolutely. Ask mum or dad to do the test first. Yeah, definitely. That's a really good option. Makes it, if mum and dad do it, it must be okay. That's why I do it too. I know they don't necessarily know me, but if I'm friendly and I'm showing them that it's okay, that might help. We often book them to come back in now. They know what to expect. Yes, and don't see that as a failure. That's a really good option, Rachel. So ultimately with that child, that's absolutely fine. We're not going to get you to do anything that you don't want to do today. And I got down to their level, having that eye contact and communicating. And we didn't get a full test that day, but we did get some engagement. I did get a little bit of a two-way conversation rather than me just talking. So they did start to chat to me. We like I said, we didn't get the test that day, but I have had other times where I have managed to get the test that day by spending that little bit of extra time explaining it, by getting mum or dad to do the test and demonstrating it myself. And I think that's the important thing. If they come back, that's a positive thing. You've done pretty well. So some children will do it first time. Oops, need to go that. What have I done? Oh, there we go, putting the answer up for you. Oh, I've lost you guys now, so I'll just pop so I can still see you in the chat. But yeah, coming back and then getting the test subsequently afterwards, don't see that first appointment as a failure, because the very fact they've come back to you, you've started to build that trust, haven't you? So don't see it as a failure, but do some information giving without overwhelming. That's when I would signpost to the Asthma and Lung UK bit, so that mum and dad, caregiver, can help explain it to the child as well. If it's something along the lines of teaching peak flow, spirometry or FeNO, I might even give them the mouthpiece that we've attempted with today, just to take home, play with it, use it on their teddy if they want to. That's going to do absolutely no harm. So yeah, there's some suggestions here, but I think you've pretty much covered it really. But approach, get to the child's level, use simple language, like if it is the spirometry, blow out the candles or keep it flickering if it's FeNO. Demonstrate first, you and or the parent. Use play-based techniques, games, counting, targets, that sort of thing. Try and break it down a little bit, short attempts. Don't push them, don't rush it to keep going. If the first test wasn't very good, we're not going to say that. We're going to say what they did well and suggest some changes for next time. Don't push them into it. Let them have that time and sort of just reset. Use your visual incentives. I would recommend, funds allowing, that you do have some stickers and things like that for, like, I know there is a bit of sort of a contentious issue, isn't it, whether we should or shouldn't give rewards. I think it does depend on the situation as well and the family. But use and also if you have got children in the room, other children in the room, I mentioned that the parent that was sort of struggling, it is okay for them to have a bit of screen time if that's going to distract them during that time. I have been known to load something up on my computer to distract the other people in the appointment. So that can help. Means sometimes it's just any means to try and make that appointment as successful and as pain-free as possible. Yeah, definitely always FeNO first anyway. That FeNO tends to be easier than spirometry, but actually there is a clinical reason for that as well, because of blowing off the nitric oxide when you do spirometry. So always FeNO first. If unsuccessful, reattempt later in the appointment, or exactly as Rachel mentioned, rebook, get them to come back. Make sure that appointment ends positively. That's the key thing. Don't end it on I'm really flustered and frustrated, and that will really come out in the appointment to both the child and the family. Don't force it. You get a risk of poor quality results and the child not wanting to come back. So I would say the key message is success equals engagement, not perfection. You can't always be perfect. When I'm also talking about testing with children, because like I said, historically, these tests have been done on adults, and then we haven't been able to access them in children because either people aren't trained to do the tests, or they just really think, oh gosh, it's children, I'm really worried about doing that, or I really don't think they're going to be able to do it. This is going to be a nightmare consultation. And that doesn't help as a starting point. But you will be amazed. I'm sure you've all experienced this. Children don't have a hidden agenda. They just want to have fun and do their best, and they love a game. And some of them are very, very competitive. So they want to do better than you as well when you've demonstrated. So yeah, it's very much about that. Don't be afraid to test in children, because they will surprise you. They sometimes manage better than the adults do. Oh, there we go. That's not moving on for a minute. So the disengaged teen, you know the one, hood up. One word answers. If any of you got teens like this at home, hood up, one word answers. I've had one myself. Wouldn't make eye contact, looking down, phone out, that type of thing. You know the sort of thing I mean. In that appointment that I had, it was Dad, and Dad was answering all the questions I was asking. I'm trying to talk directly to the teen. Dad's answering all the questions. How do we deal with this? They're just not interested. How do you deal with that? They won't necessarily refuse, but it doesn't feel like a very positive appointment, does it? Which, it's not helpful. So what do we do with a disengaged teen? What might help with that? I've just realized you might wonder why I'm looking at two different places. I've got my slides and then I've got you guys. So when I'm looking over here, I'm looking at you. How do we manage that disengaged teen? So parent or caregivers answering all the questions, but actually a teen is very well equipped to tell us, especially if you're taking a history, for those of you that are involved in diagnosis or doing an annual review and that sort of thing, or you're trying to get some information out before you do the tests, we want to actually hear from the teen. So what are we going to do? Keep looking at the teen and hope they look at you. Yeah, it's quite hard to avoid eye contact if you're kind of looking at the person, isn't it? It's very difficult because you don't want to say, can you put your phone down and engage in this consultation? That's not going to go down well. I would sort of say, I've just got a few questions for you, if that's okay. And the sort of thing that I do is, especially because we're talking really respiratory today, aren't we? So if they're coming in for FeNO or spirometry, yes, you've hit the nail on the head. It's probably going to be affecting their interest. So the symptoms that they're getting and the reason they're here today for the test is probably, it could be wheeze, cough, breathlessness, chest tightness. So I'm going to say, I've noticed, we've got some information here and you're getting these symptoms. That must really be affecting what you're doing. How does it affect you? So they might say, this particular teen that I'm thinking of, it was football. So I said, these tests today are really going to help us to get to the bottom of actually what's causing your symptoms that are affecting your game. And that must be really frustrating for you. So I've got a few questions to ask you, if that's okay. Then I'm going to explain the test. And then hopefully after this today, we might be able to do something about it. And that's how you get in there. It's the hook in with the interest, isn't it? But make it clear in a friendly, non-threatening way that it's so useful to hear from mum, dad and caregiver. But I've got some questions for you, because obviously these symptoms are happening to you. They're affecting, the things that you want to do and your hobbies. So yeah, that's exactly what I would do. And I'm going to be honest with you, in that appointment, for me, it wasn't negative, but, I just felt slightly disappointed that, I didn't get as much conversation, or, clearly the team didn't want to be there. But actually you shouldn't. I'm hard on myself, as I'm sure lots of us are very self-critical. You should take it as a win, because I did get a good test. And actually they did talk a little bit about their football, a little bit, not much. It was still kind of 1 or 2 word answers, but we got there. Okay, so you got to take the wins. I'd say it's a big win. So yeah, speak directly to the young person, not just the parent. Be honest and concise. This helps us to see how your lungs are doing. Link to their goals: sport, sleep, fewer symptoms. Some of these sort of teens may be exam age, for example. So this is going to make that easier. Yeah, get the grunting. Absolutely. The practical tips: offer autonomy. So a bit about a choice, and make their feelings and their thoughts and their symptoms feel valid. Essentially giving them that validation, that sense of, it is important you're here, we are trying to help you. And I quite often say, how do you think we can help you? What would you like to get out of today? And if you're ready to do the next part of the test, but they're kind of busy on their phone, I'll sort of say things like, so we're ready for the next part. Do you want to try now, or do you need a bit more of a rest before the next blow? It's giving them a little bit of sense of autonomy and control as well. very much use the tech and the data. So, you know, you might even relate to your child or nieces or nephews or whatever, that they've now got a mobile phone and you can't get them off it or something, but in a non-threatening kind of jokey banter way. It's really important. But and then I talk about the usefulness of technology. And actually, I might sign, if they're teenage and they've got a phone and mum and dad consent, that they can have some of the links to the explanations around this test and how to manage asthma, so it doesn't affect their football, their netball, their hockey, whatever they're doing. Show them the results if they're interested. And keep it efficient. Try and avoid over explaining. You know, clear, concise is really important. And if they are anxious and want more explanation, that's absolutely fine. But going over the same thing, and also if it's a teen, speaking really slow, and it can come across as patronizing. So we've just got to be aware of our tone and our body language. You know, it makes a really big difference. If disengagement continues, and it does happen, explore the barriers. Maybe actually they're just embarrassed. Maybe they've got a partner on the other end of that text message who's just ended their relationship. Maybe they've got separated parents and they're worried about whose house they're going to. You know, there's so much going on in this age group. We forget sometimes peer pressure, puberty, relationship issues. It's a lot to be dealing with. And sadly, we do see a lot more eating disorders. We see a lot more breathing pattern and anxiety disorders. So we've got to have that, you know, always thinking about actually something else could be going on. This could be might be a bad day for you, but it also might be a bad day for them. So yeah, consider rebooking rather than forcing a poor effort. Okay, but engagement improves effort. That will lead to your better quality test. Okay. Right, what about the anxious parent then? I hope you don't get this too often, because with FeNO and spirometry, they are non-invasive. I've had this very much with a blood test, so I do pediatric bloods myself well, when I was employed in a practice independently. I'm still happy to sort of do that. So you can understand you're going to be putting a needle in this person's daughter, son, or whatever, and that can be anxiety, you know, that can bring about an anxious patient. So that's completely normal. So I think it's still an important scenario to cover. But how do you think an anxious parent impacts the appointment? And how would you deal with that if you had that in one of your appointments with a family? So they might be saying things like, are you sure this is okay? Are you sure this is safe? You know, in that blood test appointment, is what if they move? What if what if they do this? What if they do that? How do you think that impacts the child? How do you think the build up to this appointment has gone? The car journey here with the parent that's already petrified? Difficult, isn't it? It's a bit like when they come in for their preschool immunisations. You can very much tell how things have gone in the car journey on the way here. Got any tips? It definitely makes the child more anxious. You're completely right. That you know, it's amazing what children pick up. They are like sponges. They absorb the environment. They absorb what's going on around them. They pick up on how their parents, their caregivers feel about the surgery or medical environment and the test itself. They're listening to everything that parent is saying in that appointment. Yeah, so that's not ideal for the child. But anything, how would you solve this? How would you improve on that consultation? It's not just about the child anymore, is it? Got any tips? Explain and do the test on you. Yes, so show the parent what you're going to do. Absolutely. I guess, obviously, I mentioned the blood test, that at the moment you're not doing pediatric bloods, but you might have an anxious patient coming in for an adult, for example. But if it is a non-invasive test, then absolutely you can. Yeah, so you're absolutely right there, Lou. You need to shift your attention at the moment to the parent, because if that carries on, that child's going to be getting more anxious and more anxious and more anxious. With that blood test appointment, by the way, that child was remarkable, because the parent was really anxious, and we got a successful blood test that day, by the way. But as you mentioned, I completely shifted my focus to the parent for a little while, calmly and simply explained what we were going to do. In that scenario, they mentioned about moving. We then brought the child back into it was an older child anyway, but we brought them back into the conversation about, making sure that it was a blood test. So keeping still keeping nice and still. And actually, if you keep nice and still, it's it's far less likely to hurt, and it will be a little scratch if we get, getting the vein first time. It's just talking them through the process essentially, without going into too much detail and obviously with regards to a blood test. But the tests that you're doing in the hubs with children, your FeNO, your spirometry, you might be doing a peak flow. They're far less invasive. They're very safe tests to be doing. So you need to shift your focus to the parent. You need to make sure that you don't completely alienate the child, of course. So acknowledge their concern. It's completely normal to feel worried when you're bringing your child in for a test that you haven't seen or don't know much about. And that's actually why it's useful to provide some information in advance of these tests. But you could also load that information up there and then and talk them through it. And if you're not confident talking through it too much, then again, use the prompts on the Asthma and Lung UK website. The tests in particular that you guys are doing, safe, non-invasive and routine. Use those words with the parent: safe, non-invasive, completely routine. We do these every day with lots of children and families. We can reassure you. Explain what will happen step by step. Do the test, show them. Absolutely. Keep language calm and simple. Avoid the medical terminology, because they just think, I don't know what that is. Now I'm really worried. What is that? So use terminology that they can understand. Consider providing some information in advance next time. That's one of my biggest tips. Okay, we don't want them coming in worried. We want them calm, reassured, a bit of an expectation about what's going to happen. That can really help. That can help everyone, you and them. Makes for a much more efficient consultation. You do have to manage the impact on the child. So although you divert your attention to the anxious parent, you also need to gently refocus attention onto the child. Encourage the patient to support calmly, but not to overcoach or pressure them. Okay. And if the anxiety does persist, again, pause and reset. Rush testing reduces quality. But if you can have a calm parent, that will equal a calmer child and better results. But I do want to be completely transparent. It doesn't always end up positive, does it? And that does sometimes happen. And sometimes it does mean that you send them away with some information. You've had a bit of a rapport during the test. They've got to know you. You just might have to bring them back. That is okay. So don't feel like you failed. All right. Not everything results in a positive consultation. So allow enough time. You might need more time than you have with adults. Go slower, better results. Build trust first, get to know them. Maybe even tell them a little bit about yourself, what you do. Build that trust, make it fun. Praise every effort every time. Okay, that makes them feel good about it. Okay, you're not criticizing. And if stuck, pause, reset, tell them, show them, get them to have a go themselves. All right, so that's sort of good tips to just have in your mind, really. And ultimately, as I said, it's not always positive. If the child is too distressed, or the parent, you're worried about the parent as well, the symptoms worsen, because if they're attending with a cough or breathlessness, for example, obviously you might need a full ABCD assessment and observations if you're concerned, and get a clinician in with you if it's outside of your remit. But if it's just that this is aggravating things, the child's too distressed, you're unsure, okay, then the key message is comfort and safety first mindset. Don't continue if there's any doubt that it's not going to be safe, that you've got symptoms that are worsening, it's aggravating their symptoms. You're better to stop, get some advice if you feel you need it, assessment, especially if they're becoming very symptomatic, or just rebook the test. Okay, so always comfort and safety first. We're not pushing anyone into anything. We certainly don't want to make them feel worse. Is there anything else I wanted to say about that? Oh, no, I'll say that later, I think. So key takeaways then. What really matters? Engagement. That is fundamental. Talking to the child, being aware of the family in the room as well, but that definitely improves results. Get down to their level. Hi, my name is always a really good start. Keep it simple and positive. Calm child, calm family definitely equals better results. You make the difference. As I said at the beginning, the very beginning, your role is essential. Your role matters. You make the difference. And as I've said, it's not about perfect tests every time. It's about getting the best that you can, engaging the child, getting the best from them. Okay, so if you take anything away from today, really, it would absolutely be those key points. Focus on the best that you can get on that day. And I always think of it like a battery. Sometimes you come into work, your battery might not be full. Your battery might be, you were woken up last night, you didn't sleep well, you're worried about something else. Maybe you've got a medical appointment, something you're concerned about. Our batteries are not always full. So you've got your battery and you've got the child's battery and the family's battery. You're probably never all going to come into that consultation with a full battery, giving and getting your absolute best. And that's what we just have to be aware of. We can do our best in that situation with that individual person. And that's the key. Everyone's individual. If the child leaves feeling like they did well, done your job. That can be a happy consultation and you can feel pleased. And that is the end of my presentation. So yeah, I hope you found it useful. We've got some time now to answer any questions if anyone's got any. If anyone's got any comments as well, there is a feedback for this. I've forgotten to put the QR code at the end, so we'll make sure that gets emailed out to you, because this is the first time I've delivered the training, the 1 hour training, so it's super helpful to get your feedback. For those that are also going to be watching this on record, we have a few plans. Because if you're not attending it live, you haven't got that opportunity to ask questions. So if there is demand for it, we could sort of every so often, so it'll be a time scale, and then we could have like a live Q&A. So I won't go through the slides again, but it would just be a very short 20 minutes, half an hour, where people can join that meeting, and any of you that are on today can also join. And you might think, well, actually, yeah, that was really useful, but I've gone back into practice and I've now got these questions. Then we could do some sort of Q&As to support that. Like I said, if you want sort of more training on things like doing the test itself, FeNO, spirometry, peak flow, then we can look at some training and some education for those sorts of things as well. So it's about you telling us how we can help you within your community investigation hub kind of roles as well. Right, let's have a look. Good, I'm glad. You're welcome. I see Surgery sends some information. In that, is there tips for parents? Yeah, great question. It depends what they send, really, Lou. So the Asthma and Lung UK, if I just come out of here a moment, I'll just stop sharing and then I will reshare with you, because I'm going to load the children and young people's asthma pathway. And I've also, well, I'll show you this first. So this is the Asthma and Lung UK website. And obviously, we are hoping that as many people as possible join the 3-hour training. So that's any healthcare professional involved in history taking, diagnosing, chronic management, including annual reviews, acute management, anything like that, that they will attend the 3-hour training, where of course I talk about you guys in the community investigation hubs, and maximising, making sure we're utilising you, but also that we send out appropriate information in advance, and also that the referrals are appropriate, because I'm sure you probably do get some inappropriate referrals at times. And this is definitely something I signpost to on that training as well. So asthma in your child, and you can literally go on any of these things. So it might be if they're getting diagnosed with asthma potentially, there's information here about the tests, how to support your child. You could go on any of these. And what I do up here is I copy and paste that link and I put it into Accurix and text it to the parent. Okay, so what will the test show? Test to diagnose, it talks you through all of it. There is also a section on explaining the test as well. Okay, so there's the tests there. And then for us as healthcare professionals as well, in here, this is the healthcare professional hub. Oh, I don't want to sign up. In here, if I went to asthma in children, I can learn lots about this as well. And there is information, I think, in here in talking to parents and things as well. So this is really good stuff, and a lot of people still don't know about it. So there's about your lung conditions and go to asthma in children. That's for families and children. And then there's the healthcare professional section, which is more for you guys. And there is some amazing resources on, can you see my screen at the moment, by the way? You can, fantastic. There is also some amazing resources on beat asthma. So before I show you the pathway, Lou, would you like to unmute? You've got your hand up. Oh, I can't hear you. There we go.
It was another query, really. And I suppose, so it isn't really this question. We do find a lot with spirometry and FeNO that patients come to us, both children and adults, with a preconceived idea that they're going to have this test and we're going to diagnose them at the appointment.
Right.
And we talk to them, we overcome it, but we do quite often, parents especially, leave quite annoyed thinking that they're going to have a diagnosis from it.
Absolutely. And laying out clear expectations on this patient pathway for families and children is so important. We don't want, they're coming to you and they're now disappointed. And I don't want that in my consultation. So it's so important that you feed back to the practice. And I know that's difficult because it's finding time to do all these things, isn't it? It's about feeding back to the practice that the family or the adult or child that came into that appointment was expecting to have this test and get a diagnosis today. And just have a chat with them about what information are you giving? Have they made that conclusion on their own, or has something that the practice has said led them to that conclusion? Because obviously that's really important. So I'll make sure that I sort of mention that as well on the 3-hour training, just sort of making sure they've got clear expectations, that the hub provide the tests ultimately, and that those tests will then come back to me as the requesting clinician, and we will be in touch. And I always, it might be a phone call, it might be getting them back in, that you need to tell them what that process is, that they will then get their results. So yeah, I think you're right. Just laying out expectations will avoid disappointment. So please do feed back to the practices when that happens. And on any training that I do, I mean, I do always talk about inappropriate referrals, and I do always talk about expectations. So, we'll make sure we keep re-embedding. And I'll jot that down as well, because that might be a theme that comes out in the Q&A as well. So I think that's an important one. Thanks, Lou. That's really useful. Before the FeNO appointment, it would be helpful for us and child parent, the expectations of the parent, stay calm, reassure child, etc. Yeah, absolutely, I agree. So the information giving, I think, is so important. So it's reassuring them in advance a bit about what the test is, roughly how long it takes, what to expect, and that it's non-invasive. We'll be doing this in a calm, friendly environment, and there's nothing to worry about. And I guess also giving them the opportunity to reach out with any questions in advance might be helpful, if you guys would have capacity for that. I don't know, but I think if you give the right information, the signpost to Asthma and Lung UK, that will go some way to helping with that anyway. So on this pathway, because I had it on a slide for you earlier, but I thought I would just show you, we're going to be adding, there's a few things that we're revising, and this is going to be condensed down with fewer headings, okay, because it's a bit busy. But on here, I mean, you've got how to use your inhaler. There's going to be a link to the FeNO leaflet, because there is a FeNO preparation leaflet, which tells you what to do and not to do before the appointment. Has anybody seen that one? As they are booked in to see you guys, that is something that could obviously very easily be given out in advance, whereas I do a lot of FeNO opportunistically. And I will still do it if they've done some of these things that we advise against, because I will interpret it in line with the context of that, or I might need to repeat it in the future. But giving this leaflet is really helpful. That's in the sort of 3-hour training that we talk about advising, and the link is also in the pathway under referring for tests as well. So that's something that's quite helpful. But this will be being improved. It should be done within the next week. The pathway's live now. But what I've done is I've gone back through the whole pathway and pulled across all of the resources, and I've condensed it down with fewer headings. So there's now going to be clinical resources, patients and families. So on here, there'll be significantly more, but there's support for parents and carers, asthma and your child action plan. Beat Asthma is a really lovely resource as well. In here, you've got resources for families and children, and there's loads of videos on here as well. So that's really nice. So the aim really, I think that will probably be, if you purely perform the tests and you don't interpret them or take a history, then I think the resources page will be super useful for you. Trying to think if there's anything else relevant on there as well for you on the pathway. I know some of you do the whole process, so all of it will be relevant. But there's some really nice thing about children and health inequalities and reducing those, and also about training and competency, depending on what level you're working at. and in here the link to the e-learning for health free training. 1 to 3 is free of charge, and you won't need that level of, above that level of training anyway. So you can look at this as well. That might be quite a useful one. It's also useful for appraisals and things, and making sure you've got your continuing professional development, that you've got the training to do the job that you're doing, and all those sorts of things. But again, do let us know if we can support anywhere from that perspective. So yeah, overall, I am super excited about this, because children, we've seen time and time again, oh no, we only test over 12 or over 16, or oh no, we can't do that because we don't have anyone trained. And it's a form of discrimination. And there's the Children and Young People's Bundle. There's lots of reference to that in reducing health inequalities. I think we've got that. Yeah, so back to the pathway. So there's some useful information on there. And then we've got in the resource, it might not have been put in yet, but the Children and Young People's Bundle of Care, that's a really nice one for commissioners and clinicians as well. And it's about essentially what we should be doing, and having equality and equal access to testing, diagnosis and skills within those chronic conditions that we're looking at. So yeah, it's really nice that children, that this has really been given the attention in Somerset. It's been a fantastic bit of work to be involved in, and I'm really excited about the rollout of it, and kind of supporting you guys as much as possible as well. So yeah, I hope it's been helpful. Does anybody have any further questions before we close the meeting today? No? Has it been useful? Good. I'm glad. Excellent. Thumbs up. Good. Excellent. Well, it's been lovely speaking to you all. I hope you have a lovely rest of the day, and I'm sure I'll see you on something in the future. Apologies